we will take questions from our electronic audience here.
Sorry. Okay. My apologies. The audio was not on, so now it is on. I'm sorry about that. Okay, we're good.
Okay. So I've been talking through the first few slides. I apologize. My name is Tracy Plauk, and I am the Director of Ohio Department of Mental Health and Addiction Services. I'm on the slide called Overview, and we'll be walking today through the appropriation summary for our department, and then some of the specific investments that were characterized in 4 categories during the budget proposal. To the extent that we have next steps identified, I am prepared to share a little bit about that with you today. Speak briefly on Medicaid redesign, and then as time permits toward the end of the presentation, I will take electronic questions through the webinar technology and provide answers or talk about how to achieve some follow-up. Okay, just briefly, our appropriations are listed here. The General Revenue Fund is our single largest sole source of resource for our department, and you can see here the actual amount that was spent in fiscal 15, and then the increases for 16 and 17. On an all funds basis, you've got those numbers listed there as well, and that includes not only the GRF but also all federal funds that we anticipate receiving and our estimates related to different state rotaries that help to fund our department. And then, as you probably recall, since 2013, the Medicaid services related to community mental health and addiction treatment are appropriated in the Department of Medicaid's budget, and I will not be speaking to those here in this presentation. We are going to be able to use these dollars to continue to support status quo operations at our 6 state psychiatric hospitals. We also are continuing our overall objective of reducing the size of our admin budget, and we recommended as a part of fiscal 16 that we actually reduce our GRF spending for central office admin by $1 million, and we propose to redirect these into community services. So this actually occurred, and we will continue at that $1 million reduction in fiscal 17 as well. And then I will go through in these next slides the 4 categories that you saw on my overview slide. I want to start out with criminal justice, and we have quite a few initiatives that relate to our systems interface with criminal justice, but by far the largest one in terms of appropriation and I think overall sea change and progress is the partnership that we just kicked off last week with the Department of Rehab and Corrections. Currently, and these numbers are a little bit aged now, but there are more than 50,000 individuals incarcerated in state-run facilities, state-run prisons, and the vast majority of these have history of addiction. Traditionally, the Department of Rehab and Corrections, they've been using evidence-based training approaches. They just lack sufficient resource to touch all of the individuals with treatment who have a treatment need. And so we were interested in partnering with Gary Moore and the Department of Rehab and Corrections so that we can help to further drive down the recidivism rate of individuals once they leave prison, because we know that as people receive treatment when they're incarcerated, they have a much smaller likelihood of actually returning to prison within 3 years. And you can see that the overall general population in rehab and corrections has a 27% recidivism rate, which, by the way, is almost half of the national average. We do very well, generally speaking. But for people who are able to connect with treatment, that is a 10.4% recidivism. So we obviously think that we will be able to make progress on recidivism as we connect more offenders with treatment. So the budget that was just signed by the governor includes a total of $27.4 million in fiscal 16 for our department related to this objective, and then $34.3 million in fiscal 17. We're doing a few things with these specific resources. Effective last week, we transferred 120 DRC recovery services staff to our department. They're remaining at their same institution, same rate of pay, doing the same thing, but they're now on our table of organization and our payroll. And from here, we will be hiring about 60 additional positions, individuals who are rendering clinical services within the prisons to help connect more offenders with treatment. And we'll be hiring over the course of the next 6 months. We anticipate we'll be fully staffed by this December. Related to this, we are also going to be issuing an RFP in the very near future to outsource our staffing for the therapeutic community at Pickaway Correctional Institution. About 4 years ago, we had 2 therapeutic communities within Ohio's prisons. By the end of this biennium, we will have 8. But the ones other than OhioMHAS have been outsourced, and we want to have some consistency in our approach there. So our existing staff at OhioMHAS will continue in recovery services as state employees, but they will be dispositioned to different institutions, and we will bring in a vendor for the therapeutic community at Pickaway. So when you see that here in the near term, that's a little bit of context of what that RFP is. Another major factor related to the partnership with Rehab and Corrections is to create more of a streamlined transition for individuals as they become ex-offenders and move back into Ohio's communities. We want to spend the balance of that appropriation that was listed a couple of slides ago to partner with communities to basically do in-reach to get people acclimated to treatment options in the community so that when they're released, they're more likely to have immediate access to treatment. We want to make sure that they're connected with Medicaid, and Medicaid can be a pair for those clinical services. To the extent that they need some recovery supports that are not Medicaid reimbursable, we have resources that we want to be able to provide to do things like employment support, peer services, recovery housing, etc. And so we are working on that application process, and we'll announce that later this summer. Because this is a new concept for Ohio, and because there is no shortage of complexity related to this, we want to make sure we're doing this right. We want to allow for an extended or an elongated period of time for applicants to respond to this request for applications. And so we're envisioning approximately a 2-month time period in which people can create their applications, and a couple of weeks into this time frame, we will do a vendor conference, if you will, so that we can educate interested potential applicants as well as other members of the community on more detail related to our request for applications. And I've already gone through the information on this sheet. Moving on to some other criminal justice initiatives, we have a number of things related to specialty dockets. Of note, there is $5.5 million appropriated in each year of the biennium to fund drug treatment specialty dockets in 15 named counties. And you can see the counties here on this list. There are, I believe, 5 of them were recipients of funds in this past biennium. So those are continuing, and then we're adding some additional counties. So we will be in touch with representatives of those counties specifically in the near term, and then we'll also be providing more summary information to the field in general to keep folks apprised of that work as it evolves. We also have $5 million set aside in this budget to defray payroll costs of specialty dockets that have been certified by the Ohio Supreme Court. We had a $4.4 million earmark for this last year, you may recall. So it's been increased $5 million here. And we will be issuing some guidance on how courts can access those resources in the near term as well. Also, moving on, we have a total of $2 million that we are going to devote to the Community Innovations Program. And this was a partnership with our ADAM boards and county jails and other organizations locally to expand access to addiction and mental health treatment in correctional settings, and then help to create more of a seamless transition for individuals as they leave the jail and move back into communities. What we're doing this year, because last year we ran the $1.5 million community innovation program, and then we had about $500,000 of mini grants for criminal justice purposes that was funded through the block grant. We're actually going to consolidate the approach this year so that there's one application process that interested communities would use, and you'll be hearing more about that here in the near term. We also have, I think, a unique opportunity here this year, the Stepping Up initiative that is a partnership of the Council of State Governments, Justice Center, the National Association of Counties, and other organizations, is putting an emphasis on the intersection of mental health, addiction, and the jails in an effort to have fewer individuals present there because they have not been able to access the treatment that is needed to keep them out of the criminal justice system. So we want to align our grantees of these resources with technical assistance opportunities that would come available through the Stepping Up initiative, and you'll be hearing more about that as well. Again, this application process is going to be available soon. We're in the final stages of the RFP review here. Moving on, you may recall that we had proposed $3 million to fund a series of regional demonstrations that would help maintain access to inpatient hospital capacity, psychiatric capacity when needed. And a portion of these funds are devoted explicitly to programs in the criminal justice arena. Specifically, we are planning to make an investment in mental health services in some jails in the Gallia, Jackson, Meigs, Belmont, Harrison, Monroe areas because we see a significant number of our hospital admissions to our hospital in Athens and Appalachia coming from jail transfers from those areas. So we believe that the infusion of some resources at the jail to help individuals manage through their crisis situations and just ongoing care will help create access to our hospital in Athens by others who are needing access to inpatient psychiatric care. Similarly, we have a portion of these resources that are going to be devoted to community competency restoration in Hamilton County and in all likelihood at least one additional county in that area of the state. We had $350,000 added to support costs of our community forensic centers, and this is the first increase they have seen in, I think, about 15 years. And then similarly, the probate court, the court cost line item had an addition of $500,000 a year, and that will go out pursuant to the existing formula that's been in place, and we will come much closer to covering costs in this area. I want to move on to the second area of targeted investment, and that's saving lives. Suicide prevention, we were very fortunate to have $1 million appropriated each year of this next biennium, and we want to focus on statewide infrastructure with these resources. Under the direction of Dr. Mark Hurst, folks here are working on an approach for these dollars that would include education and awareness, strategies to help support follow-up care, prevention strategies, etc. And we would be targeting this toward various sorts of audiences, and audiences meaning, you know, some maybe specialty groups that interact with people who are at high risk of suicide, or specific cohorts of Ohioans who may be at risk. We are not planning to share these dollars via a mini grant process. We want to be more targeted in their use, and we've gotten that question several times, so I just wanted to highlight that. The other topic related to saving lives is enhancing access to naloxone. We had appropriations of $500,000 a year for this purpose. The legislation, as amended through the budget process, requires us to push these resources out through the county health departments. And so with our Ohio Pharmacy Services, which is a component part of our department, we are going to be working to outreach to all county health departments, including those with whom we do not already have an existing relationship in the pharmacy arena. And we would like to make amounts available per capita by county, with each county having access to funding at least 20 kits. And the cost of a kit obviously varies day to day, but we wanted to create some kind of minimum threshold so that even the smallest of counties would have access to something of value there. We also intend to hold a little bit off the top to help manage any kind of emergency circumstances as they arise, as we know that happens from time to time, unfortunately. So we will have instructions forthcoming, both for the county health departments and for our stakeholders on a larger basis on how we're planning to administer that program. The next topical area, number 3, is support for children and families. We are continuing Strong Family Safe Communities. You may recall this was a $5 million investment over the biennium last biennium, and it's now $3 million a year or $6 million over the biennium. This partnership with the Ohio Department of Developmental Disabilities enables us to grant fund some communities to help shore up gaps in their continuum of care as it relates to children and families who are on the verge of crisis. And so we have actually already conducted the application process, and we have scored the applications. So we anticipate we'll be making an announcement of these awards in the very near term. Also, we have $2.5 million in early childhood mental health consultation resources that is made available. I don't have an update on how we're going to array those dollars today, but you'll be hearing more about that. And similarly, $1.5 million for prevention programs for children whose parents are or have been incarcerated. We know that these kids are at a much higher risk of ultimately becoming incarcerated themselves and dealing with addiction and other sorts of eventual outcomes related to trauma and the lack of stability in their household. And so you'll be hearing more about our plans there as well. The final area for targeted investments was characterized as housing and employment as recovery supports. We were successful in being able to carry forward the $15 million annually that we had requested in the executive version of the budget. This is going to support the enrollment increase that occurred with these resources when they were initially appropriated in fiscal year 15. We're also working with Ohio Medicaid to align rules that will result in more consistency among RSS recipients of how much they are responsible to pay toward their stay in an adult care facility on a monthly basis. And this is consistent with the legislative review that we had undertaken. It'll be 2 years this coming fall. So we're still working to implement all of those recommendations, but certainly this appropriation is very helpful in that regard. Moving on, we have $2.5 million per year in this next biennium for recovery housing. We got a lot of feedback from folks in the field that the application process we used last year was not the most user-friendly, and so we're going to be streamlining that application process this year. You'll be hearing more about that. We also anticipate focusing mostly on operations. We have capital funds that were made available for this purpose, and we're continuing to spend those in the second year of the capital biennium. We are going to be working toward the development of our next capital budget probably here in the fall, and we will, I'm sure, be discussing recovery housing in the context of the capital budget as well. But we believe that we'll put most of the focus of this $2.5 million that's appropriated in the operating budget on operations for the homes. And then finally, we have $1 million that has been appropriated each year for to support workforce and employment. And we have some planning underway internally. I don't have much of an update on that front today, but you'll be hearing more about that as we get into the summer. The Continuum of Care line is our main subsidy line item that goes to the ADAM boards. Funding in this line item has been reduced to account for the impact that Medicaid expansion has had in enabling individuals to acquire their medications through the Medicaid card. And so we've actually seen a decline in the amount of pharmacy that has been purchased through the Continuum of Care line in this last year. We were all asked as cabinet agencies to recognize in different ways how the benefits of Medicaid expansion are being realized in our system, and then think about what sorts of steps could be taken to really recognize that that increase on the Medicaid side as we were constructing our budgets. And so this is one area I talked about quite a bit as we were moving through the budget legislative process. We are meeting with the ATOM boards to discuss details related to implementation on this front and next steps, and we will be releasing the allocation guidelines subsequent to those discussions. It will be early next week. We'll make available the allocation guidelines for the whole field. Changing topics now, away from things that are actually appropriated in our budget to another big policy front that has actually been taking up a lot of staff time and attention here, as well as for folks who are working in the field, and that is Medicaid. Very pleased to say that the budget as passed maintains coverage of our expansion population, and to date there have been more than 527,000 newly eligible Ohioans who have connected with healthcare through Medicaid since January of 2014. So that is continued, and obviously there are behavioral health benefits that are available to those individuals as well. Thinking about the next area of work, though, we have been talking quite a bit about redesign of some elements of our Medicaid-funded behavioral health system. And what we want to do ultimately is enable access to a wider variety of reimbursable services in a cost-neutral environment. So what that means is we are not infusing significant new appropriation to create access to more services, but rather we want to create more options within the existing budget array that people could access if their clinical needs require that. As a part of this, we've talked about updating billing codes to align with the national standards, and that is something that will be a component of redesign. We actually have work groups commencing next week on the redesign issues. We have limited space, but we've had a lot of interest, and so folks have been identified for each of the work groups. And the timeline that we shared when we introduced the budget was that all this work would be done by January of 2016. And we know that we're not going to have it all done by January of 2016, and so we are going to be proposing some timeline adjustments either at the work groups or immediately prior to the work groups, but we will let you know what the new timelines are once we have those cleared with OHT, the Office of Health Transformation. But we will have, I think, a reasonable amount of time to actually do the very complex work that needs to be done in order to make sure that our transition to a redesigned system is successful. Another piece of the Medicaid redesign that I wanted to highlight is the movement to Medicaid managed care. Traditionally, we have been carved out of the managed care capitation rates, speaking for mental health and addiction services. The movement to MyCare Ohio for individuals who are dually eligible with Medicare and Medicaid was the first time that a carve-in had occurred, and so what we're looking at now is the broader Medicaid population, and having individuals who are enrolled in managed care also have their mental health and addiction services covered through that managed care plan. We had proposed that this would occur on January 1st of 2017 in the executive version of the budget. That deadline has been extended to January 1st of 2018 as a result of feedback from stakeholders and just legislative discussions related to that deadline. We will also have oversight by JMOC, or the Joint Medicaid Oversight Committee, and I anticipate that Director McCarthy and I will be reporting to JMOC on the status of our progress for the next, what would this be, 2.5 years. Unrelated to Medicaid managed care, but another change that I wanted to note for you, Medicaid had proposed to eliminate spend down in this budget, and spend down, last I knew, about 22,000 individuals in at least 1 month of last year spent down. They were not eligible for Medicaid at the beginning of the month, but once they took into account the incurred cost of health care that they had to pay, they basically brought their income down to the level that would make them eligible for Medicaid. And so as Ohio moves to eliminate that, we want to make sure that individuals with serious and persistent mental illness who are in the age-blind disabled category of Medicaid, when they are spent down to Medicaid, can continue to access key services that help to keep them healthy and well. CPST would be an example of something like this. I say mental illness here because individuals with solely addictive disorders, but not other physical health care challenges or serious and persistent mental illness, they are not traditionally included in the age-blind disabled category of Medicaid. And so, you know, if someone has co-occurring substance use disorder issues, they could be served here as well. But the key area of focus is actually individuals with mental illness. Moving on to some language changes, and I realize I forgot to put that in the overview slide, but we do have a number of language changes I wanted to bring to your attention. First of all, we were challenged by SAMHSA to make sure that we were very explicit that our maintenance of effort is met in part by the Medicaid spending that now occurs outside of our department's budget. And so we were able to change the budget bill to reflect that, so that we can ensure that we're continuing to receive our our SAPC block grant monies. We also, as we proposed in the budget, have aligned confidentiality law to HIPAA for individuals who are decedent patients of the state hospitals, and I think that was people who'd been passed away more than 50 years ago. So it has no bearing on current patients or anything. Also, we've got some streamlining language related to licensure and certification. We have the option to suspend admission in additional provider categories now, not just youth residential, which was where we initially had that flexibility. Ohio Pharmacy Services is the new name for the former Office of Support Services, because they're focused solely on an array of pharmacy services. We thought a name change would make some sense. And we have also removed the requirement to report on the old House Bill 484 funds that no longer exist in our budget. There is also new language that was introduced during the course of the legislative process to enable communities to establish blood-borne infectious disease prevention programs. Can I actually say what that is? I'll actually tell you what that is. That is needle exchange. Part of the, yeah, so that's what that is. You can read more about that. We also have a new committee that is being established, the Joint Legislative Committee on Multi-System Youth. Legislators throughout the process heard, I think, from quite a number of advocates that there continues to be challenges in accessing services in different parts of the state for kids with different circumstances. And so a committee will be established to take and look at this. We've also got an increase of the cigarette tax of 35 cents a pack. I make mention of this because many individuals who are served in our system are, a disproportionate number of them are smokers relative to the general population. And we want to continue to focus on wellness and smoking cessation efforts whenever possible. The increase in the tax has some deterrent effect on smoking, as you're probably aware. Also, there is a comprehensive case management and employment initiative that is actually led by the Office of Job, or the Ohio Department of Job and Family Services, and the Office of Human Services Innovation. And I know that quite a number of our stakeholders and advocacy organizations have been following that through the budget process. So you'll be hearing more about that as well. I just threw a lot of stuff at you in the last 35 minutes or so. There are some links on this page that provide information not only to our department's budget, but the overall state budget and policies related to the Office of Health Transformation. So, for example, the comprehensive case management that was on the last slide, you can find out more about that on the OHT website. At this point, I would encourage you to follow us on all manner of social media, and I can see that we've got some questions here, so I'll just start going through and scroll up to the top of the list here, and we'll get started. The question is, the first question is, will the $5.5 million for the drug court program be distributed through the boards or directly to the courts?
I think that's still open for discussion, but I think it's currently through the board.
Yeah, I'm looking at this. I do not have an answer at this point. I think that the distribution at this point is through the boards. So I think we are evaluating options there. I can take that one back and we can find out and report back on that question. The funding, though, for the payroll will be directly to the courts. That $5 million earmark, as was the case last year as well. And that's the only question we've received?
Yes.
Really? Okay. I thought there were other questions there.
Noting the audio problem.
Okay. Okay. Well, it appears that's the only question that we've received. So,
oh, here we go.
Oh, there's more. Hang on.
Oh, we got you.
We're scrolling up to see the questions. Hang on a second. Okay. The next question is, when foster youth age out of foster care system, we encourage them to sign up for Medicaid. Will they be required to pay co-pays?
The same, right? That's what the budget says, that's pending federal.
The budget says that they shall pay co-pays, but that's pending some federal guidance and feedback. So we will refer that question over to Ohio Medicaid and can get an answer on that. The next one, will there still be funding for regional ambassadors to work throughout the state to be funded in the current budget? I'm not sure if this is related to, I'm not sure what that question references, regional ambassadors. Whoever posed the question, if you want to elaborate, that would be appreciated. The next question, do you know who will be responsible for convening the Legislative Committee on Multi-System Youth? I believe that is the Department of Job and Family Services, but we will clarify that as well. We're going to the next question here, scrolling. It is JFS? Okay, we'll clarify that. The next question is, can you provide any details on monthly Medicaid premiums and its impact on various high-risk populations? I think that's something that we could follow up on, certainly. I don't have that information in front of me right now. Oh, okay. The question on the regional ambassadors has been clarified. Regional ambassadors are contractors through the Ohio Empowerment Coalition. Jody, I will need to check on that. That is not related to GRF funding, as I understand it. I believe that's block grant money. So let me, we can follow up on that one. I was more focused on GRF initiatives in this presentation, so I apologize. I don't have an answer for you right now.
That's our last one.
Okay.
Oh, sorry.
One more question here. Oh, that's more for Jody. Okay. All right. Well, I believe that's our last question. So thank you for your attention this afternoon, and we will seek some clarification on the questions that were posed that I couldn't answer today and follow up. I believe we have the name of every person who asked those questions. So
we did just have one more comment.
Oh, we did have one more question. Will monies for recovery homes be distributed to independent owners or to organizations owning recovery homes? I believe that all of the all the funds that we've distributed to date are through organizations. So I anticipate that would be the case going forward as well. Okay, well, thank you for your time, and look forward to more updates on our website and through our e-update News Now email system as we have them.